And good afternoon, everyone. I'm WPTV reporter Ryan Hughes, and today we are working on a really important story. Over the past couple of weeks, so many of you have been reaching out to us as you struggle and as you express your frustration with trying to get a COVID-19 vaccine appointment through Publix. Well, this afternoon, we're going to be speaking with the Director of Communications for Publix, trying to answer any questions that we can for you to make that process a little easier. Thousands of appointments will be going live once again tomorrow morning. But let's take a look back over the past couple of weeks about the struggles and the frustration you all have been experiencing.
Very frustrating. It needs to be a little simpler.
Gloria Kopp's urging Publix to make its online pharmacy portal more user-friendly after walking away empty-handed Friday trying to secure a vaccine appointment for her husband.
I went on at exactly 6 o'clock, and it put me in this waiting room where it says, they're going to refresh because there's so many people online.
Publix tells WPTV more than 48,900 appointments were booked in less than 2.5 hours, and at any given point in the morning, more than 300,000 customers were trying to reserve an appointment. The grocery chain also fielding complaints on Twitter, telling customers to make sure its site remained stable. Publix limited the number of people in the reservation system.
We had 3 computer screens opened, a laptop, a desktop, and a tablet.
Nancy Keith in North Palm Beach also woke up early to secure a spot, but never made it through.
It was frustrating for me because I just couldn't get an appointment.
And many of you asked, why aren't there separate waiting rooms and staggered times for each individual county? So we asked Publix those questions.
In a statement, Publix answered, quote, "We continue to make enhancements to improve the experience of our customers. Demand is greater than the supply, so there isn't a simple solution to address all concerns."
I'll keep trying Publix, and in the meantime, I'll keep trying the health department.
Publix says appointments in Florida will likely reopen at 6 a.m. Wednesday morning. Ryan Hughes, WPTV, News Channel 5.
And those are just 2 people among the many that we have been hearing from over the past couple of weeks, from Palm Beach County up through the Treasure Coast, all throughout our area. So let's bring in Maria Brous. She is the Director of Communications for Publix, hoping that she can answer a lot of your questions this afternoon. I know there's a lot of questions that you all have. One of them being, when's the best time that I should be signing on? Can I use more than one device, or do I need to be only using one laptop? Can I have multiple? Which vaccine am I getting? We've been hearing so many different questions. I think we're having a little problem trying to get Maria on the line here, but we'll work to get her. She's trying to get back in right now. So we have been hearing that Publix has been listening to all the feedback that you guys have been giving to them. I know many of you have been calling them. Obviously, many of you have been calling us. So they have been making changes to their website. There is now a timer on the website that you will see tomorrow. And we're hearing that some 38,000 appointments will be made available starting on Friday morning. Again, that's at 6 a.m. We're also want to know how much prep time went into this, because it seems that a couple of weeks ago, Publix went live, but how much time went into getting this website off the ground, knowing that thousands and thousands of people were going to be relying on it. So we're going to try and get Maria Brous back on the line. We've been talking with her over the past couple of weeks. She is the Director of Communications, and she tells us that it's been a struggle, and she's aware of the struggles. And obviously, Publix is asking everyone to have patience with them as they try and, work out the kinks, so to speak, and listen to your feedback and try and make this site as easy as possible. One of the things that we've also been hearing, one complaint from just a story that I covered, is that one woman was able to get an appointment for her husband, but she wasn't able to get an appointment for herself. We're now possibly hearing that Publix is allowing you to book more than one appointment at a time, but I think they're going to be putting a cap on that. So that is something we're also going to be trying to ask Maria about as well. Some news for today: Palm Beach County Commissioner Greg Weiss, he sent a letter to the CEO of Publix. Todd Jones is his name. He was obviously thanking Publix for all of their hard work throughout this process, but also asking him now to streamline the process and make it more accessible and efficient for everyone. Three different questions that he has that he is hoping that Publix can answer. Is Publix going to consider adding a phone line for maybe some of those seniors that aren't as tech savvy? Maybe they don't have a computer at home. Is there another way that they can get a vaccine, especially in Palm Beach County when they are going to be the only provider for the COVID-19 vaccine? Also, for the seniors that have tried in the past and that have been unsuccessful, will they be put on some type of a waiting list, or do they have to, again, start all the way from the beginning and start all the way from scratch? That's another question that he wants answered. Also, and this is a question many of you have had, will Publix consider expanding the sign-up hours, not just to make it at 6 a.m., maybe offer it at different times of the day? I know a lot of you have mentioned that you're waking up at the early hours, 5:30, trying to get your devices and your laptops ready. But what about those people that have to get out the door and have to get out to work, that you're trying to get an appointment for your parents? Will Publix maybe think about trying to open that up later on in the afternoon? And there she is, the woman of the hour, Maria Brous, the Director of Communications for Publix. First of all, we just want to thank you for joining us and answering a lot of our questions this afternoon.
My pleasure, Ryan. Thank you for having us.
So let's start off with a message that you have for the seniors in our community and, of course, across the state that have been struggling and have been facing a lot of difficulty trying to get an appointment. What's your advice for them?
Our advice is to have patience. As we've spoken about, there are simply not enough vaccines for all of the demand that we have across our operating area. There are so many seniors that would like to get the vaccine, and it's simply a supply and demand issue right now. So to have patience with the system, to know that as vaccines become available, more appointments will become available, and working through that process. Wednesday we had more than 37,000 seniors that were able to get appointments. So we were very, happy that we were able to get those seniors appointments, and we continue to work with, the governor's office to get more vaccines.
One question I want to jump to some of our viewers. Kathy is on the line here. She says, why can't each individual county register the vaccines instead of all counties at once to make it impossible to register?
So our counties are, they all go up at the same time. And then we ask that our customers have a plan like you and I talked about previously, knowing that if one county, if appointments are booked, and then they already have another county in mind. Appointments vary by location. So not every single location will have exactly the same amount of appointments. And if you're in different counties, you may be willing to drive or cross over into another county to receive a vaccine. So the availability of having open appointments so that we can have as many appointments and for having options for our customers as well.
So can you walk us through, as you mentioned, 38,000 appointments will go live once again tomorrow morning. Can you walk us through the process? What are the best tips that people can follow to try and get that appointment?
Right. I would say have your information available. So as we talked about, having your Medicare card, if you have insurance, having your Medicare number with you. Also making a plan. What county is it that you're looking to get a vaccine in? And then knowing where the other counties are. If you go to our publix.com/COVID vaccine page, you see all of the counties currently listed where vaccines are available. Making a selection, thinking about, okay, here's my primary county of where I want to go, but I'm willing to drive to these following counties, so that if your county is fully booked by the time you're able to enter, then you have another backup plan.
Valerie Eaton says, I was lucky enough to get our first shots in another county from the health department. How can I get a second shot here at home? She doesn't want to make that drive, especially if it makes me sick.
And just to make sure, Ryan, did she have her first dose? Was it at a Publix, in a different county at Publix, or in the county location? Because those are two different answers.
It seems that she got it from another county from the health department. That's what she's saying here.
Okay. So she would have to, if she were coming to Publix, she would have to go to the reservation system to make an appointment and go through that same process. We would recommend that if she went through the county, that she contact the county and understand their process better. They may have a different process than we do.
So we already have a lot of questions coming in, and I know that you guys have been receiving a lot of feedback as well. Talk about some of the changes that you have already made to your website from when you first launched.
So this week, Ryan, our customers will see two new features. So one is a countdown clock so that they can understand that the page is refreshing, because oftentimes if nothing is happening, they may have thought that maybe it froze or that it wasn't working. So having the countdown clock helps our customers see that there is something actually happening, and the page will refresh automatically. So there's no need to refresh the page on their own. Also, they will see how many appointments are available by county. So we also updated that feature. We had customers asking that they wanted to know if there were appointments still available in the county that they were looking for. So there is as the page refreshes, they'll also see whether appointments are available or how many appointments. And if there are no appointments available in that county, it'll say fully booked when all appointments are taken.
One woman that I spoke to says that she was able to get an appointment for her husband, but then she wasn't able to get an appointment for herself. How many appointments can you book at one time? Can you book more than one?
That's an excellent question, Ryan. There's a maximum of up to 4 appointments that you can book when you're in the actual system. But remember that for every appointment, the demand is so great. So for every one appointment, there are at least 10 other people trying for that same appointment. When we think about the numbers, they're staggering, of having almost 300,000 people that were waiting to make an appointment on Wednesday. And we anticipate similar numbers again tomorrow.
Joe Salerno here says Publix pharmacy isn't big enough to handle the volume. How would you respond to that? Is Publix able to handle the volume across the state, especially in Palm Beach County, where that's going to be the main provider of the vaccine?
Well, with more than 748 pharmacies across the state, Ryan, we have access that customers can come in a convenient place. Many have changed, routines since COVID, but our customers are still coming to the grocery store or looking to us as a place of community. We are equipped with our pharmacists. We have the opportunity, quite simply right now, it's supply and demand. We have more pharmacies that could offer vaccines, but we need more vaccines in order to have more appointments.
Isabel asks a really good question, one that I had myself. Is having multiple devices on at the same time a bad idea when trying to get an appointment?
There's not a need to have the multiple devices. Ryan, as our customers come into the waiting room, they're coming through in that process. And as we talked about before, as we allow people into the next phase, folks have to be finished making their appointment. As they exit, then we enter the next group of customers that are coming in. So there's not a need to have multiple devices, but again, having the most updated version of the browser is absolutely essential.
What about the refresh? I know so many people have been asking, refresh or do not refresh the page?
No need to refresh the page. That goes back to the countdown clock that we have. So as the countdown clock goes and hits 0, it will automatically refresh the page for them.
How much time did Publix have to prepare this site for the vaccine appointments, knowing that so many people, thousands and thousands of people, were going to be relying on it to get that appointment?
As you might imagine, we have teams, cross-functional teams that are working on this day and night, Ryan, taking customer feedback into account every single day that we receive, working around the clock to make sure that there are enhancements and improvements. We want it to be simple for our customers. We are in the habit of making our customers happy and a pleasurable experience, and we don't want this to be any different for them. We take that feedback very seriously and continue to enhance the system.
So Lucinda says one problem that she experienced was once I got to choosing a time and a place that was taken, I then had to go back and enter emergency contact information, and it appears to answer some medical questions that took time. She says that was very repetitive. Is this a back and forth type of a process, or is that one step after the other to make that appointment?
It is in sequential order of how to make the appointment. So it's that's how the sequence works. But again, it is having all of the information readily available, inputting that information, and continuing to go to the next step.
One of our commissioners in Palm Beach County sent a letter to the CEO today of Publix because of that high demand, which you've been speaking about, asking for Publix to start streamlining this process to make it more accessible and efficient for everything. He had 3 big bullet points that I want to ask you about. Is Publix considering adding a phone line, maybe for some of those seniors that don't have access to a computer, or maybe their loved ones are trying from different states? Is there a phone line in consideration?
We have that on our list of considerations, Ryan, but not at this time. All appointments are working through our online reservation system. So we continue to take the feedback, and we do have a running list of feedback that we're receiving and considering.
Another question, and I talked to a couple of people that had this problem. They almost got to the finish line, but then they were unsuccessful. So take for instance, when the appointments go live again tomorrow morning, is Publix considering some type of a waiting list from one appointment time to the next so that they don't have to start all over from scratch the next time appointments go live?
It's almost impossible to do that, Ryan, for the sheer fact of the numbers that we're looking at, with over 300,000 folks trying to access at any one particular time. That means that there was an excess of that on any given moment through that process. So unfortunately, there's not a way to store information or hold that information to come back and start, the process from where you left off. But again, having patience and understanding that it's a supply and demand, and as more supply becomes available, more appointments will open up.
What about the time? I know you guys go live at 6 a.m. and you'll go live again tomorrow at 6 a.m. Some seniors are waking up incredibly early. Some of their children that are trying to get an appointment for them have to get out the door to work. Are you considering expanding the sign-up hours to different points of the day?
We also have that under consideration for the work that requires to get the vaccines actually prepped and ready, and the process that happens to get those vaccines to store locations. We need the additional time, so everything happens sequentially for us, Ryan, but we have heard that feedback. At this time, we cannot make that change, but we do have it on the list to consider for future.
Lucille says, I would also like to know why our information isn't populated when we have to go back and select another time or location, instead of having to retype all their information all over again.
And without knowing exactly what point of the process they're in, it's a little bit difficult to know what happened in that particular instance, Ryan. So I think it's kind of going through the process and entering the information and then selecting. But if there's an opportunity or something that happened, we can take that down and we can look into that further as well.
Okay. What are some tips for success as we get ready to launch, thousands of additional appointments tomorrow? Give us some of those best practices again for maybe people that are just joining in right now.
Sure. No need to join prior to 6. So 6 a.m. is the start time. We recommend being able to log on at 6 o'clock, making sure you have the latest browser installed on whatever device you're going to use. Also having patience and coming with a game plan as far as which counties you're able to drive to get your vaccine. And then knowing that if you have insurance, having your Medicare number available so that you can enter that. And then also recognizing that there is a maximum of 4 appointments that any one person can make.
What about the second shot? Joy asks, once you get that first appointment, do you get that second appointment automatically?
You do. If you had your vaccine at Publix, our process is that 4 weeks later, at the same Publix, the same day of the week, the same time that your original appointment was, you will have your second dose of Moderna issued at that same Publix pharmacy.
What if you have somebody that needs to reschedule? They were able and lucky enough to get an appointment, but something happened and they're not able to make it. Is there an easy process to reschedule, or do they also have to start all the way from the beginning again?
Ryan, they would have to go back online to our reservation system and go through the process of reserving an appointment.
Okay. How is Publix going to help those who don't have computers? Mary wants to know.
That's an excellent question. For vaccines at Publix, we have not only now for the COVID vaccine, but we've administered vaccines for flu shots and pneumonia and shingles, et cetera. And what we found is that our seniors have the opportunity and have great neighbors, friends, families who have helped. And we've seen many of those stories hold true for the COVID vaccine, where they've enlisted the help of family and friends and other members as they're making appointments.
Dorothy is asking, hopefully we can pull up the website one more time. She's just asking us to show how to use the website again. Can you walk us through that one more time?
Sure. So when you go to publix.com/COVID vaccine, the page that you're seeing now will pop up. You select your state. In this case, it would be Florida. As you enter, and because it's not live currently, you wouldn't see the countdown clock, but you will start to see a countdown clock that will show you that you are in our waiting area and that the page will automatically refresh. As you scroll down, there are counties that are located. So as you make it into our next step in the process, you would select your county. And then you would, from once you make the county selection, and again, you won't see it here, but then it is the process of starting to enter your information. So as the screen changes, you will follow, ultimately remembering once you book your appointment that you have to accept and do the check mark at the last page and confirm. And once you hit the confirm button, that's when you have a secured appointment.
Okay, Connie has a good question here. She just popped up. She wants to know, why is there not a standby line at the end of the day for people that do not show up to their appointments?
The appointments, if someone should miss an appointment, those appointments roll over into the next available reservation systems. We do not want lines at the stores. We're still social distancing. There's no guarantee that people would not make their appointments. So it really is, we don't want people just guessing and waiting around to determine if there's an opportunity. We will recycle that appointment for the following week, and then it'll be available the next week.
Just remind our viewers, if you will, what vaccine are they getting?
They're getting the Moderna vaccine.
We ran a story yesterday in our western communities of Palm Beach County, Belle Glade, Pahokee, South Bay. The nearest Publix for them is at least 20 to 25 miles away. Has Publix considered any type of mobile unit that they can use if someone in those communities gets an appointment, that Publix can have a mobile unit to get out there to help administer vaccines?
So as we work with the governor's office, there's very specific requirements that we're following. We are in-store vaccine. That is kind of where our place has been, is in the in-store experience. I know Governor DeSantis has partnerships with other businesses and community organizations in how we go about the process. So for Publix, once we receive vaccines, the governor will also share with us the counties that he's asking that we go into, again, with three main factors: a population of 65 and older, also either more rural or not having an established system that's already working in that particular county.
Karen asks, as you just mentioned, right now, it's only for 65 and older. When will you open it up for younger people? Is that timeline even being considered at this point?
That is a timeline that is set by the governor's office. So we follow the process that the governor office sets. And right now the priority is our seniors. Seniors first has been the mantra, and we continue to follow that. Connie
asks a good question here. What time do we have to show up for our appointment? Do you advise everybody to get there a little bit early?
Their appointment is secured for their appointment time. So arriving on time is very helpful, but no need to get there. Again, we don't want to have lines of folks waiting. So our system works very efficiently. Our pharmacists are working extremely hard. They're a dedicated group of folks that know that time is valuable, and also sticking to appointment times. So getting there right on time is advisable.
Obviously, these appointments are in high demand. Are you finding that there's a lot of people that once they get the appointment, though, for some odd reason, they're not showing up? Are you having a lot of no-shows?
No-shows will always happen, Ryan, but I would not categorize it as a lot. I mean, things happen, and folks may have to get rescheduled, or they may get an appointment closer to home or a different location. But for the most part, I mean, the stories, as I've been at stores and listening to these heartfelt stories from seniors about what these vaccines mean to them and what it has meant for them to be able to get an appointment, it is so heartwarming. And we recognize the important work that we're doing.
I know that we've been getting the calls and the emails, and we've been covering the stories, obviously, about the frustrations. What have you guys been hearing? Have you had a lot of people reaching out to you directly that are unhappy with the system and want to get things changed?
Well, we love our customers, and our customers always provide us feedback. And offering the COVID vaccine is no different. Much along the same lines of the questions that we're receiving today, we have gotten those questions directly as well. The enhancements that we've made are a reflection of customer feedback that we receive. So we do take that very seriously and work in the feedback that we're able to with the system that we have. And again, we have teams that are dedicated to this. This has been a mammoth-sized project that involves all layers of our operation, from our great pharmacy team to our IS folks, to our marketing teams, to our communications teams. Everyone is all hands on deck to try to make this process as smooth as possible.
Donna has a question here that says, after your comment, I think, about the no-shows, she wants to know what happens with any unused vaccine at the end of the day.
We have a process internally for our vaccines, Ryan. So our goal is always to do 65 and older, and also making sure that we have associates that need to be vaccinated as well. So no vaccine goes wasted.
You haven't had to waste any at all?
No, the only, we have all of our vaccines accounted for. The only time a vaccine doesn't make it into the system is if a vaccine has been compromised on delivery. So when we arrive, if they've been compromised, we have to return that back to the state. Otherwise, the goal is always 100% vaccination.
Has Publix overall been generally happy with how the process has been going, or do you understand and believe as well that things do need to be updated and changed when you're talking about just the volume and the demand in the communities?
We've considered our privilege to be able to offer this service to our communities. I mean, for 90 years, we've been in the state of Florida. We recognize the importance of serving communities and making a difference. We know that there was an opportunity. The governor asked if we would assist, and we happily are doing that. We continue to make enhancements and improvements. We recognize for the more than 100,000 vaccines that we've already provided, there have been 100,000 folks that have been extremely happy with the process. We recognize also that if you haven't had success in booking appointment, there's disappointment and there's frustration, and we're working through that process. We're frustrated when our customers are frustrated, but we are not stopping from making improvements, and we continue to work on that daily.
One of the questions here, and forgive me, I forget who asked it, but it caught my eye. In Palm Beach County, will the Pfizer vaccine be distributed as well, or will it strictly be Moderna?
Currently, we're receiving Moderna.
Okay. Let me see if I can get anyone else here. How many vaccine shots do they do in 1 hour?
It will vary by location. So each store gets a different amount. So doses vary. So there's not a goal number. Per day, we can do, including when we're doing booster shots or the second dose, it's a maximum of about 125 vaccines per day.
So John has a good question here. He goes, are you assigned a number while in the waiting area, or do you have to get lucky and have your page refresh as people are exiting the booking system?
We have, as folks are in our waiting room, they're cashed in, and then we move that cashed group in as a group moves out.
Okay, very good. Maria, thank you so much, first of all, for taking the time to answer a lot of our viewers' questions. Any other tips or advice that you can offer to them or to anyone that's just joining us? Again, as we mentioned, that 38,000 appointments will go live tomorrow morning starting at 6 a.m.
They will. We're here to help. We're answering questions as customers are trying to book appointments tomorrow. Our social media team is active and engaging. Our communications team is as well. Again, having patience, knowing that it is a supply and demand, regardless of whether it was Publix or a different entity, we're all in the same boat together. There's more demand in the state than there are vaccines available. We continue to work with Governor DeSantis to get more vaccines. It is a priority for him as well as for Publix. And we continue to work on, collaborating and how do we bring vaccines to more seniors in the state.
Ginny has a question here. I think you answered it, but it's probably worth mentioning again. How do you choose a county when you're trying to schedule an appointment?
So if the county is available, then you can click on the county and then proceed to the next step. What might be occurring as someone is trying to click on a county, if that county has no appointments available any longer, it will not allow you to click on that particular county.
With so much demand out there for the vaccine, and now you guys taking these appointments at your locations, have you had to call more pharmacists or more employees into different locations to help administer all these shots?
We have a great pharmacy team. We have great supervisors that are working to help pharmacies. Like we said, it's all hands on deck. So we're moving our folks around as needed, but we have a strong team ready and willing to serve.
Robert asks here, how is a person allowed in the waiting room? 3 times I have never gotten to the room.
So as folks come in, again, recognizing that on any given moment, there's more than 300,000 folks trying to get into that waiting room. So as we come in from the group of times as they enter the system, they're put into, they're cashed in, and then they move in groups. I recognize that it may seem like a lot, but I ask for patience and try again, and maybe tomorrow will be the day.
Yes. Any drive-through vaccination sites being considered at Publix and wants to know?
Not for Publix. Again, we go back to what the criteria is from the governor's office. We are currently immunizing in-house, which is inside of our pharmacies. So that is where we're administering the vaccines. That is our role in this plan.
I know you guys have already made changes to the website. You hit on that a little bit. Do you foresee additional changes being made in the future as, hopefully more supply comes in?
We continue to make enhancements, and I don't foresee that stopping anytime in the near future, Ryan. We continue to take feedback and ask processes, and even as we're trying to go through the experience and emulating that same process internally to try to see, the experience as well, we're making adjustments as we go through.
Lisa makes a good point here. She just wants us to reiterate for everyone listening that you must realize that Moderna requires 2 doses. And you said once you get that first appointment, if you're lucky enough, that you will then be scheduled for the second, correct?
Correct. You're automatically rescheduled for the second appointment. 4 weeks later, same day of the week, same time, same Publix, you'll have your second dose.
So Joe asked a question here. Where or when in the system, when selecting a date and time, why do I have to start all over when trying to get another day and time?
Because availability varies by store location, so it won't have the same. So if you selected that for one area, if that's where you were focusing on, that may not be the time of day or day of the week even that might be available at a different location.
Can you handle, I know after you get that vaccine, you have to hang around for 15 minutes or so. It says, can they handle reactions to the vaccine? Do you have people on site for that?
That's why we asked them to stay in the vicinity or inside the store so that there are folks that can actually see them and observe. Our pharmacists are trained and will follow protocol if any reactions occur. And we're happy to report, Ryan, none that I know of. So we have been successful so far. Very good,
very good. Here's Laudine, says, my experience at Lake Worth was outstanding, in and out in 25 minutes. What are you finding once these appointments do go live? We're hearing they're being scooped up in a matter of minutes. How quickly are they being filled?
They are. Well, we're glad that there was a great experience, and that 25 minutes includes the 15 minutes of wait time. So I think we're doing great on the timeline that we're talking about here. But I agree that there's, again, supply and demand. If we think about Wednesday when we opened, we had 37,350 appointments available at 6 a.m. In an hour and a half, those appointments were already taken. And again, we know that there were at least 300,000 people that wanted to get appointments that weren't able to. So supply and demand, patience, and then being ready to go the next go around as well.
I know Publix instituted a lot of safety protocols when the pandemic first began. Mary Elizabeth Hallahan wants to know, how do we know we are safe when we're shopping there still so many months in now?
There are still many of those same protocols are still in place, Ryan. So we still have social messaging messages and intercom announcements. Also, when there's places at the register to remind our customers of 6 feet apart, we are still dedicated to enhanced cleaning. That does not change for us. We understand the importance of cleaning and sanitizing and touch points throughout our store. So all of those are still the safety and well-being of our customers and associates and community remains our top priority at Publix.
Donna brings up an interesting point here. We understand that supply and demand is an issue. But has Publix considered maybe only vaccinating those 80 and up first and then trying to tackle the 65 to 80 age group?
That is not a decision for us to make, Ryan. We have to follow the decisions that are made at the state level. So we follow the guidance that Governor DeSantis sets out for us. And that's kind of how this process has worked all along, and we continue to follow.
Kathy asks, Maria, does the county light up when it becomes available?
All of the counties, as we come through, they are all available when you start. So it is all there, and you see the appointments. Remember, we talked about having the number of available appointments. So you'll see the number of available appointments, and as the appointments become full, that counter is ticking down, and then it'll switch to fully booked.
Kathy's asking here, is the sign up every Wednesday and every Friday morning, or is it just whenever you get additional supply? How do you determine the day for the appointments?
It will depend on when we receive vaccines and how many vaccines we receive. So just because it has been that way, that is no indication of what it'll be moving forward each week. If we're lucky enough to receive the vaccines and continue to have appointments available, we'll communicate it through our media partners. We also, if we know in advance of when those days are, so if you're on our website today, it'll tell you to come back on Friday because we knew that we had appointments that would be available on Friday. So going to publix.com/COVID vaccine, we'll always have the most updated information for our customers.
So you answered this question, but I want to bring it up again because it's one that we get asked a lot. I know we don't need an extra device, Cindy says, but people are going to do it anyway. Does that slow the process down? Even though you said you don't need more than one, does having more than one slow down that process?
It takes the place of another person that's actually trying to get in potentially. So really having one device is all that you need, and having the most updated browser is the recommended approach.
Okay. So, and I don't know if Maria, if you can answer this or not. This is more like a health department question, but you may have knowledge on this. If you've had COVID, how long do you have to wait before you can get the vaccine?
So there is a COVID questionnaire that takes place when you go to the store, and they've asked you if you've had COVID within the past 90 days, I believe it is. But again, I would go back to the forms and making sure that you speak to your doctor if you have any specific questions related to the vaccine or COVID.
And let's go back to that booking page just one more time if we can. Jan is asking us to kind of run it through one more time. I know a lot of people are eager for tomorrow morning when the appointments become available. Can we bring up that one more time? And Maria, can you just walk us through again for people just joining, just a simple follow, take us through the process and some tips for tomorrow?
Absolutely. So making sure you have the right URL is important. So if you go to publix.com/COVID vaccine, that's always going to be the page that you want to go to. Once you're on that page, select your state, which in our case would be Florida. Once you click Florida, you'll have some information. It goes through the eligibility. Tomorrow morning, if you enter at 6 a.m., you'll start to see the countdown clock will be in that very top part. And then as you scroll down, counties available, you will see the number of appointments that are available by county. As you get ready to move into the next phase, you're able to select that county and then start entering your information that's required to do the registration process.
And what is some of that information that is needed to register? One of our viewers asking here, in addition to your Medicare number, as they're getting ready to and having all their documents prepared and maybe on the kitchen table, what information will you be asking people?
Your personal information, which you don't need to get anything in reference for, but if you have your Medicare card, having that readily available there is helpful. And then everything else customers should already know.
One question that was good, but it just jumped from me, but I think I caught it. It says, why not lock in the appointment first and then put in your information? Why do you have to put in your information first in order to lock in the appointment?
We've got to get you registered and processed through the system. So being able to enter that information, it's the same process that every customer is going through at the same time. We would still have the same question if we were able to lock in on appointments. It would still be, I tried to get it. It's the same part. It's supply and demand. There's just not enough vaccine for the amount of demand that we have currently.
One woman is asking, can I book me and my husband? You answered that, but I think it's worth asking again. You said that you can book more than one appointment at a time if you get through.
You can book up to 4 appointments per person as you're logged in. It is important to note, though, that even though it's a spouse or maybe a family member or someone living in the same household, it doesn't mean that the same store on the same day around the same time will be available, because if you recall, there's so many people also accessing the system at the same time that that may not be feasible. So just recognize that you can make more than one appointment, but there is no guarantee that it will be at the same store or relatively around the same time.
What can you tell us is the most common complaint that you are receiving that you've already tried to fix and change for people?
Well, I think at top of mind for us really is the countdown clock, only simply because it does show our customers that there's activity occurring. There's not a guessing of whether should I back out of this page or do I need to refresh it or where do I refresh it. The system is doing it for you and you're seeing that happening in real time. Additionally, it's the update on appointment availability. Our customers wanted insight into what was available. And, you know, if, for instance, I'm only interested in a particular county, like I can only be, you know, in Palm Beach, then as you see that, if appointments are booked and then, you know, you may opt not to remain in the system because there's not a desire to drive someplace else.
Are you able to book more than one county at a time, or do you only have the option to choose one?
So when you're in your information, as you book the next appointment, you can select a different county.
Okay, very good. Maria, thank you so much. You've answered a lot of our viewer questions, and I'm sure more are going to be coming in throughout the afternoon. We're going to continue to follow this story. Again, you said 38,000 appointments will go live at 6 a.m. tomorrow morning. And just to reiterate, you said that you'll continue to take customers' feedback, and you do expect changes in the near future as well, probably, right?
We continue to make changes. We have dedicated teams that are discussing literally around the clock, Ryan, on making adjustments and changes. We take our feedback very seriously. And again, we have to prioritize the feedback. We can't make all changes, even things that our customers think make sense. You know, we have to make sure that when you adjust something, it doesn't impact something else in the system. It is, you know, code. You have to be able not to make, you know, inadvertent subsequent changes to other parts of your system while trying to address one issue.
Okay, very good. Maria, we appreciate your time. Thank you for answering as many questions as you can. And we appreciate the undertaking that you guys are doing in our community, trying to help as many people as possible. We will have more on this and the process, and more appointments being open tomorrow with Publix, and some tips for success later on this afternoon, and of course, this evening on WPTV News Channel 5. Thank you all for participating, and thank you for sending in your questions. We appreciate it. And Maria, thank you so much.
Our pleasure. Thank you so much.
Take care. Have a great afternoon, everyone.